Good evening, good afternoon, and good morning. This is the 1952nd day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Kumar from Kerala. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 9:30. From 9:30 to 10:30, we have the international session in English, and from 9:30 to 10:30, we have the Malayalam session and we are uploading the videos of the same on the very next day itself, so that those who miss the session can watch it again. You can share it with your friends, whether it be a homeopathic lover or a homeopathic doctor or a student. It doesn't matter much. What is the purpose? Is to take homeopathy to every home around the world. And today, let me come to our guest, Dr. Kumar G. Doctor is a multi-specialist in all sense, because he has began his career with the DHMS, and then he went to BHMS, and then MD in homeopathy, and in between he took MBBS, and then MD in modern medicine, and then MD in Ayurveda, diploma in natural, that is yoga and naturopathy, and MBA in hospital management and LLB. What a professional he is. And he was the retired assistant director, government health services, Kerala, and he was the ex-state commissioner, government secretary, ex-officio government of Kerala. He was the ex-honorary lecturer at the Krishna Homeopathic Medical College, Kanyakumari, and ex-honorary lecturer at White Memorial Homeopathic Medical College, Tamil Nadu. He has more than 40 years of clinical experiences, and he is one of the most wanted faculty in ISK and other associations from his younger age itself. So he has made lots of scientific sessions with the different categories of doctors, as well as he has made a lot of public health awareness classes for almost all kind of people. And he has presented beautiful sessions in English some month back, and has presented in both Malayalam as well as in the English. He has visited most of the leading practitioners of India, most of the legends, I must say, in that way. And today, Doctor will be presenting about Miasm, its clinical application. As you all know, this is a very, very important subject. There are many case presentation, as well as there are many type of presentation over Miasm. This will be an entirely different one, because Dr. Kumar has such a variety of presentation with him. So I am inviting the guest of the day, Dr. Kumar, to this session. Doctor, please unmute yourself and you can begin the session. Welcome.
Good evening to all viewers of IFPH. I think I am coming for the fifth time or so in IFPH program. I came to know about this IFPH only very late. I attended the last seminar in Ernakulam. There I came to know very detailed programs of IFPH. So I am now cooperating with them at utmost sincerity, and I wish all homeopaths a well good practice and a well good life. Okay, let us start. Let's start. Okay, this is a highly. I am talking today about the miasms, my views. Last class I presented in the webinar my views of homeopathy. or my own homeopathy. So this subject is highly debatable. It's not conclusive, but still I am presenting you before you. You can go through it and you can differ also. You can cooperate also.
Okay,
So,
so Mr. Shalu Rajan will sharing the screen. Whether
okay.
okay, let us start screen sharing.
Yeah. Yeah.
Okay, Shalu, you can share the screen.
Oh, okay, sir. I will try. Just one minute.
Can you see me? Can you?
Yes,
Am I
yes,
audible?
yes. You are everything
Okay.
fine.
Yeah, I'll say some introduction also. There, by the
okay,
time
okay,
we can make the screen ready. Okay.
okay.
As an introduction, I would say that in nature you can see certain phenomena and certain driving forces. The phenomena is three in nature. That is, one is materialism, the other one is dynamism, and the third one is, you can say, lifeism. So the materialism, as an example, is our tincture medicines, our allopathic medicines, Ayurvedic medicines. As dynamism, we can say, as an example, our patentized medicines, and also the galvanism, mesmerism, or electricity, or even ultrasound, which was not there at the time of Hahnemann. So that is a dynamism. Coming to the third phenomena, that is lifeism. So lifeism, as an example, we can say the uh, the thing in the last part of the organon, or the fifth edition, as well as in the sixth edition, Hanuman was saying about vital energy is, again he converted vital force into vital energy, vital energy into life energy, or in the life force, like that. Finally, he is coming near to the spiritual force also, that you can see in the fifth aphorism as well as in the sixth aphorism. Spiritualism is coming in the last stage of organon. So that is the
Doctor,
lifeism.
doctor, can you see the screen?
Yeah, I can see. But
Okay,
can
okay.
you little enlarge? Can you enlarge it?
Because
Okay,
it is
okay,
from the
fine,
phone.
fine, 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 fine. Thank you. Thank you. So that is the phenomenon, materialism, dynamism, and lifeism. Coming to the next driving force, you can see the three, which is three in nature. They are environment and time and nature. As an example, I can tell, in the body itself, there is a driving force. For example, if you during birth, in some children or in some neonates, the testes may not be present in the scrotum. So within 1 year, that will descend and may come to the scrotum. So when you see a doctor, even before that, the doctor will say you will wait for 1 year. By the time it may descend to the scrotum. So there is a driving force in the body itself. Another example is the closure of the frontal. Frontal usually closes within 1 year. Similarly, the ASD, atrial septal defect, or the foramen ovale, all this will close within 1 year in most of the cases, and only some cases it surgical intervention is necessary. So always there is a driving force in the body. So that driving force can be utilized, or can be utilized by homeopath by your medication also. For example, last class I told you, I don't know whether somebody heard it or not, the Mongolism. The Mongolism is curable, provided you can get the treatment in homeopathy as early as possible. Better, it should be within the 1 month or neonatal age itself. As you all know, that Mongolism can be diagnosed in the labor table itself. That is the first day itself we can diagnose the Mongolism. So from that first day onwards, if you diagnose the Mongolism and if you start treatment, you can bring the child to almost the normal, but it will take a long time. It will take 1 to 5 years to get by up to that time you have to take treatment, then it will be getting corrected and it will become almost the normal baby or normal child. So that why, because in the body itself there is a driving, and that mechanism should be utilized from the first life itself, so that you are stimulating the driving force which is present in the body in the first year of life. So that is the thing. Next one, coming to the environment. Actually, it is I can say it is a rule that is environment decides, time accounts, and nature decides or manifest or identify. So, in short, you can say environment decides, time accounts, and nature identifies or manifests. For example, environment. Suppose if you are putting a egg in the incubator, after a fixed period, that will hatch out into a chicken. Or if you are putting a rosa stick or rosa stick in the floor, that will usually degenerate and destruct. Suppose if you are planting it in a pot and you are nurturing it by means of manuring and watering, it will come into a bush of rose, and it will give up the flower also, and that will give the identity. So the environment will decide. So putting a branch of or a stem of a rose tree in the floor, it degenerates. But if you are making an environment, which will grow into a plant. Similarly, egg also like that. So there the time is the deciding factor. For all these things there is a fixed time or there is a nominal time, that which decide the nature, and always that nature will keep the identity. The rose stem will come into a rose bush, and the flowering will be there. The egg will come into a chick, like that. So that is another phenomena which is. So I said about, in short, I said about three phenomena related to the nature, that is materialism, dynamism, and lifeism. And the driving force, I said, it is environment, time, and nature. Similar, further we will go into detail. And can you please share me the first slide? Actually, it is third slide. Hello, doctor?
Yes, sir. Rule of trios. There is a third slide.
Third slide. Third slide. First is.
Can you see rule of trios?
Third slide. I cannot see. It's not on the screen.
Sir, you can see the screen.
No, I can't see. Sorry.
Oh, 1 minute.
Others can see or not? I don't know.
Okay, now already I shared that, but 1 minute. Sir, can you see?
Sorry.
Yes, visible.
Others can see?
Which one see?
Rule
of trios.
Third one, sir. Third one. That is materialism, dynamism, like that.
Yeah, yes. Materialism, dynamism.
Others can see? I can't see, but if it's visible to others, yeah.
Yes,
okay.
visible.
Now it is okay. So, yeah. So what I said, the three phenomena: materialism, dynamism, lifeism. You just ignore the cancer. That is for presentation for some other topic, So here, the environment, the other three factors: environment, which external as well as internal, then time, and the nature. Okay, next slide. Next one, please. Next slide. Okay. Okay. Here, another thing you have to, yeah, next one. This is what I said, no? Environment decides, time accounts, and nature identifies. And this slide, again, I told about the seedling, or I told about the egg in incubator, like that. Next one, please. Next slide, please. Okay. Before this, here you have to understand one thing. That is, if you take water and if you heat it to boil, it will become vaporized, or it will vaporized, and it will, when you cool this water, again you can gain water. Or when you vaporize it, it may split into hydrogen and oxygen. When you cool it, it will return to water state. No, but if you take milk and if you heat it, it will also convert it into vapor. But when you add ferment, when you ferment it, it will turn into buttermilk, and you can separate it. You can buttermilk, and later it will change into ghee, and then if you heat ghee, it will turn into oil. Why? This is, but here this ghee or oil cannot be reconverted into milk. Why, you know? Because the milk, when it is got fermented, and when it passes into ghee, when it passes into oil, a a liphism is active. That means when fermented, fermentation is by means of a liphism. Bacteria will be fermenting it. So a liphism is incorporated with this, and that is why it is not reversible. Understand? Then, so sorry. Yeah. Next, coming to this slide, that is, you can see liphism and dynamism, and you can see the materialism. What I want to convey with this slide, the idea is, you can develop diseases starting from materialism to dynamism, then to liphism, and it can got a exhibited or got manifested. Similarly, it can come in the reverse order. Right? First, it will affect the liphism, then come to the dynamism, then it will be manifesting in the materialism. I will give you an example so that you will understand it. Suppose if you are fitting an artificial denture and it is ill-fitting, it will got irritating your gum, and later it will cause thickening of the gum or thickening of the borders of the tongue or cheek. Later it will become a small ulcer. Later it will become a big ulcer. In the long run, after 10 or 20 years, it will become it will turn into cancer. So here the cancer is starting in the material level, coming to the dynamic level, and finally coming to the lifestyle level. Understood? See, the reverse thing can occur. For example, if you are hearing a shocking news, or one of your family member is all of a sudden died, then it will affect your liphism, and after a few days it will be manifesting in your body as an ulcer, then turning into cancer. This will take only a very minimal time. The other will take years to develop, but this liphism affecting problem will manifest easily. Suppose one of your earning member, your husband or your wife or your children that dies. Then you after a few days, your tongue will show a small ulcer. After within a few months or days, it will turn into a chronic ulcer, and it will change into malignancy. So there, the liphism is affected. And the importance of understanding this is the treatment side. As far as my knowledge goes, you may differ, but as far as my knowledge goes, the treatment is different. You can in case of the first one, starting from materialism to dynamism to lifeism, you can have low potencies and you can wait for some time and you can reach that level of cure. But in the second incident or second case, it requires repeated medicines, highest potencies and all. And this phenomena was noticed by Hahnemann also. Hahnemann also, in his Aphorism 282, he says, and he says, we need large doses of specific remedies early and, if necessary, several times a daily, and gradually ascend to higher degree of dynamization. In the aphorism 282 footnote, he says that here his treatment of the chronic diseases and the psoriasis, syphilis, psychosis departs absolutely from that advised in the former editions. And similarly, you can see in 148 absorption, the method of cure is resorted. Health are to be considered more on spiritual concept than on materialistic concept. There he completely eradicate or denying the materia peccans or material as the cause of the disease. And finally, he come to a state of lifeism, or you can say rather spiritualism, and that is what controls the life force or life energy, he says. So that is there. This slide actually, what I said, materialism, your crude drug, homeo tinctures, Ayurvedic medicines, allopathic medicines, all are materialistic. Next slide, please. Next slide, please. Yeah. Sorry. Dynamism, your dynamic medicine, magnetism, galvanism, electricity, ultrasound, laser, and radiotherapy. Next. Here, what is dynamics medicine? You can see in explanation, you can understand it as the attenuated medicine is no longer in the state of solid or liquid or gas, but in the radiant state of dynamic, a fourth state of substance, said to be a borderland where matter and no force seems to be blend. Medicines thus brought to the radiant state are no longer subjected to chemical reactions and can be administered effectively in food and drink. No longer subjected to chemical reactions means here you have to understand that the present way of research or the present research modalities or research criteria is not applicable to a dynamic system of medicine or homeopathic system of medicine. So the pillars of homeopathy or the scholars of homeopathy or the legends of homeopathy should think in terms of this, and they should develop a different protocol for assessing a homeopathic system of medicine or explaining its scientificity of homeopathy. So that's my request also. Next slide, please. This is what I said, lifeism. That is, this lifeism can be affected by or can be influenced by yoga, meditation, hypnotism, Reiki, spiritual healing, faith healing, spiritual or faith healing, or even by live vaccines, even genetic or organic organ transplantation, or even by cloning. So that is as an example I said, the milk is converted into yogurt and then it is converted into butter and oil. And why it is not reversible? Because it is affected by fermentation, and in fermentation a life force is acting, and that is why it is. So here the life force can be influenced by life force only, and that's why yoga, mesmerism, and all this is acting on the lifeism. Next one, please. So from this line onwards, I am coming into the actual subject, miasm. This is, I said in the first sentence itself, I said it is debatable and it is not conclusive. It is a view of mine regarding miasm. So I am of opinion that miasm is present in healthy state, in morbid state, and in medicines also. And all the three miasms are there in healthy state, all the three miasms are in morbid state, all the three miasms are there in the medicine also. So if you take a miasm as such, the miasm is always in a vibratory state in the body, vibrating. So before that, what is the concept of miasm? As far as I am concerned, is it is a chronic syndrome. It is not, according to me, it is not. For example, if you take psychosis, it is not the gonorrheal infection or the residue of gonorrheal infection. If you take syphilitic miasm, it is not the syphilitic infection. Then what is it? It is, as Hahnemann used, this is a combination, or this is a state of chronic syndrome, just like jaundice or just like anuria or just like uremia. A combination of symptoms are arranged in a better way and in a specific way. That is miasm. So you will have the psoric miasm, you will have the psychotic miasm, you will have the syphilitic miasm. And a lot of people are saying you are having the tubercular miasm. Then why not you can have the another infection miasm? So that is not there. Only three things, according to me, that is the psora, syphilis, psychosis. So somebody is classifying it again as acute miasm, chronic miasm, acute recurring miasm, and acute non-recurring miasm, half acute miasm, then accessory miasms, tuberculous miasm, like that. So many classifications are. Why these miasms? Why these miasms comes? Well, during the treatment of chronic diseases, even after 30 years of practice by Hahnemann, he found that certain chronic diseases are not responding, even though the prescriptions and all are correct. Then he thought of a chronic miasms or chronic diseases and came out these miasms. Actually, it is a combination of symptoms or syndromes. That is my view about the miasm. So this miasm is present during health, during morbid state, and in the medicinal system also. So it is always in a vibratory state. Vibratory means it's having a pendular like of movement, and it is that range within a normal range. And if it surpasses the normal range, then you will call it as hypo or decreased. Or if it passes on the other side, it is increased or hyper, you will call it. That's why you get a hypotension, hypertension, and there is a normal range. Hyper what is called blood sugar and hypo blood sugar. Understood. So there is always a range between the normal vibrations, and when it surpasses the one, you will get hyper state and you will get the hypo state. That's my view about the miasm in general. So I said in a miasm, all the three are there. One will become predominant, one will become recessive, the other will be dominant, and the prominent or dominant miasm we will call it as basic miasm. So altogether, if you calculate the three miasms, which in normal state, in decreased state, in hyper state, if you take a combination, you will get 84 combinations. Then coming to the next one, the miasms you can get in both, I said, both in healthy state as well as in disease state. So physiological state, pathological. Here it exists both in functional state and cellular state, both. That is physiological functional state, physiological cellular state, pathological functional state, pathological cellular state. Next one, please. Yeah. Sorenum. If you take physiological state of the sorenum, you will have normal appetite. You will have normal sleep. You will have thirst. Suppose that thirst increases So that is the normal state. So you will have appetite, you will have thirst, you will have sleep. If you come to the cellular component, now you will have a normal BP, you will have a normal temperature, normal blood sugar, a normal heart rate, normal pulse rate, like that, normal secretions of the body, like that. Next one, please. Yeah. If you take the pathological, your appetite is decreased. If the appetite goes on decreasing, and that condition is called as anorexia nervosa. For example, a condition called anorexia, where the appetite, the patient will not take anything at all. That is decreasing. You will have severe appetite, or you will have ravenous appetite. Then you will call it as, then you will say, go and check the blood sugar. Sometimes you may be diabetic also. So that is increased appetite. Like that, you will have sleep or sleeplessness. You will have thirst or not thirst at all. That's a pathological state. Coming to the cellular level, the pathological state of sorenum is the BP is very low. It will go on decreasing. That is hypotension. It will go on increasing. Then it will become hypertension. Similarly, tachycardia, increased pulse rate, bradycardia, hypothermia, hyperthermia. Like that, the pathological state increased and decreased in that vibratory condition of the miasm in soric level. Next one, please. Psychosis. Here, the physiological condition, you will have happiness, you will have sorrow, you will have, when you hear a good news, you will be very happy. When you hear a sad news, you will be becoming sorrow. You will have some anxiety, you will have some desire, you will have some aversions. That are all psychotic manifestation in physiological level. So suppose we come to the other side, cellular level, you will have normal saliva, you will have normal cerebrospinal fluid. It is not CSP, it is CSF. Cerebrospinal fluid. You will have normal motion. You have normal urination. Then in between the pleura, you will have normal level of fluid between the pleuras. Like that. That is, it's our physiological function of the psychosis. Next, coming to the next stage. Slide, please. Psychosis. That is why you will hear a news, then you will be going into sad mood, and you are continuing that sad moods into days and days. Then you will become pathological, no? Like that, if you are fever and it is continuing for a number of days, temperature is increased, that is pathological, no? Then you will have hyperactivity. You will have normal activity, no? If you become hyperactive, you will call diseased. Similarly, if you come to the pathological stage of the psychotic miasm, chemostasis. When a bacteria enters into your body, or the first, if it is an allergy, for example, if it is an allergic thing entering into the body, the first cell that will be enormously increased in your system is the eosinophils. That is the first defensive organ. If a bacteria is entering into your body, the first cell will be the polymorphonuclear lupus. So that chemotoxic mechanism is an example of a pathological cellular mechanism. Similarly, when there is an inflammation, redness comes, edema comes, like that. Next one, please. Next slide, please. Yeah. Syphilitic. Here also the physiological is, if you hear a bad news, you will be crying. Suppose one of your family member is lost, you will be crying. But if you go on crying, going on crying for a number of days, you will become disease. Normal crying is normal, no? If you are, that is a soric response. But if you are going on crying, then it is a disease state. Then next one. Sorry. Similarly, laughing also. If you hear a joke, you will laugh. Coming to the physiological state of a cellular mechanism, phagocytosis. The other one is chemotaxis. The cells will produce certain chemical things, and it will destruct the enemy or destruct the bacteria or virus, like that. In phagocytosis, what it will occur? The cells will engulf the thing and will do all these things. So that is a syphilitic miasm. Similarly, in normal physiological state, the cellular mechanism is in females every 28 days or 30 days there is menstruation. The internal lining as well as the blood vessel will be distracted and it will be coming out as menstruation. Similarly, scavenging cell. All these are examples of syphilitic mechanisms within the body. So any syphilitic normal mechanism within the body is the physiological state. As a prime example is menstruation. Next one. Next one, please. Okay, syphilitic pathological mechanism. You are getting suicide, and you are carrying a revenge in the mind, and at a suitable situation you are killing a person. That is the manifestation in the functional level of Thora, pathological manifestation of syphilis in the functional level, pathological state of syphilis in the functional level. You are carrying a revenge in the mind, and a final situation comes, or a fine situation, or a environment comes, you are doing a crime. That is a pathological state. In cellular level, a chronic ulcer or a gangrene or an infarction or a infiltration in malignancy. All these are examples of syphilis. Infarction, mainly why I said it is an example of syphilitic pathological state. They are inside the normal cells, the bleeding occurs. Within the heart muscle, the bleeding occurs, and there forms a destruction. Similarly, in CVA, within the brain, within the normal brain, bleeding comes and it causes a destruction of the or it will turn into morbid state. So that is why the syphilitic pathological state. Understood. Next one, please. Yeah. I said all the three miasms are there. So usually when the symptoms comes and finally you send the person to MRI at the patient level, it is functional. If you take this MRI and you see a mass or a tumor in the MRI, it is the functional level only, because the patient is not having the symptoms. You see only when taking a MRI only. So that is the functional level only, pathological state functional level. Suppose if you are examining and seeing, or the patient is complaining a mass in the abdomen, and you are examining and if you are seeing a mass, then it is a psychotic. And if you are seeing an ulcer, then it becomes syphilitic. So understood. Next one, please. Yeah. This is examples of psoric miasm. Moles, neurofibroma, dermoid, colitis. Even though all the three miasms are there, the psoric miasms is predominant. That is why you get a moles which is fixed, which is not enlarging, which is not spreading or metastasis. Like that, you will get, as an example, leukoplakia, adenomyosis, fibroids, PCOD, etc., etc. Next one. Then the second combination, SORA and psychosis. Here there is a difference. In this combination, which one is predominant? Suppose the predominance is psoric miasm, even though the psychotic miasm is along with that, then because of the dominancy of the psoric miasm, the Paget's disease, which is an limited. Paget's disease can come both in the bone as well as in the breast, around the nipples. No, so it becomes localized growth around the nipples. So that is because of the psoric miasm predominant. If the syphilitic miasms, if the psychotic miasms becomes predominant along with SORA, and the dominant miasm in that state it is SORA, then it will become a warty growth or brain tumor or hepatoma, like that. Next slide, please. Yeah. Next is a psora and syphilis combination. Here also the two stage where the psora is increased or the or the syphilitic miasm. If the psora is predominant in the combination, the example in melanoma, even though it is a cancerous condition, it will not spread. It will be limited. When the syphilitic miasm takes an upper hand, the melanoma will start to spread. Similarly, Hodgkin's disease. It will be limited. When it takes the upper hand, syphilis takes the upper hand, it will spread. Then the renal cell carcinoma. This is very important because the renal cell carcinoma actually the predominance, the initial stage itself is a psoric miasm. When the syphilitic miasm takes an upper lead, it gradually invaginates into the renal veins. The renal carcinoma spreads through the renal veins. So there by the syphilitic miasm take a predominance. All the other cancers spread through the means, through the arteries, blood through it. But this carcinoma specifically spread through the renal veins and blocking the renal veins. Like that it spread. That is the psoric miasm mainly in the initial stage. When the upper hand is taken by the syphilis, it starts to spread. The prostatic carcinoma, definitely, even though all the three miasms are there, the syphilitic miasm takes an upper hand. That's why it's earlier than itself, it spread to the distant part like skull or vertebra or like that, or ribs like that, or hip bone like that. So there the syphilitic miasm is predominant. Next one, please. Yeah, all the three miasms almost in the same active state, that is leukemia. And if all the miasms in active state, as well as if it is combined with the drug miasm, especially in chemotherapy and all, that is drug miasm, if it combines with that, the scope is very, very less. Scope is very, very less. Then spread, as I said earlier, is spread like that. So when according to the predominance or dominancy of the miasm, it spread like that. A local spread, mainly the psoric miasms will be predominant, and if it is distant spread by like in prostatic carcinoma, this syphilitic miasm, even though all the other two miasms are there, the syphilitic miasm takes an upper hand. Next one, please. Right. Yeah. Yeah. This what I said earlier itself. So, for example, simply psora, then it is a benign growth. If the psora is predominant and the psychotic miasm is there, then the spread will be a local spread. If the psychotic miasm takes the upper hand, then it will be locally spreading. The tumor will be infiltrating as well as it spread to the opposite side. Another very good example where the psychotic miasm is very prominent and the psora is very low in activity, then for example, if you take the gastric carcinoma, the gastric cancerous cell will gravitate into the abdominal cavity and it will lodge in the abdominal cavity and a Krukenberg's tumor will develop. No. So that is an example of a where the predominant psychotic miasm, even though psora and syphilis is there. Then the lymphatic spread, mainly the opposite spread. Then there also the psychotic miasm is very predominant. Next slide, please. Then, in combination of syphilis with the psychotic with the psoric miasm, if the psora is very predominant, as I said earlier, in renal carcinomas, the spread will be through the veins. Renal veins, it gradually spread to and causes blockage and all. If the syphilitic miasm is very prominent, as in case of hepatic carcinoma or what do you call it as hepatocellular carcinoma, then it will be spreading to pancreas, spreading to the lungs, to the bones like that. No, where syphilitic miasm is very prominent to the bones and blood and all. All the three miasms, as I said earlier, it will be leukemia. mainly leukemia, it goes like that. Next one, within 2 minutes, I will complete. Last point I want to tell you is the miasms in medicines. That's very, very important. I don't know whether I think Sahani sir and all will agree or not. Sir will have got a very good experience in it. All medicines have this state also. That is why when you prove the medicines, for example, if I am saying I got a pain in my upper limb, in the mid of arm, then I am asking my doctor friends what's the medicine. I am explaining about the nature of the pain and all. Then the doctors will say, "You please take Rustov." Then I said, "I took Rustov." Then the other doctor will say, "Then you take Symphytum." Or the third doctor will say, "You take the Ruta," like so on. Nobody is saying you take Sina. Why? Because during proving also the medicines has got different affinity to different systems of body, tissues of the body, organs of the body, even the even the cells of the body. According to this nature, the miasmatic nature of the disease or the drug or the medicine, it differs or it produces different symptoms. And that too also according to the potency of the drug. Usually, Rustov, usually it is proved in the connective tissues, act on the connective tissue. Then if you take another medicine, it will act as, it act on the cardiac tissues of the body mainly. Like, why? Because it is, one reason is the miasm itself. Second reason is when you prove the medicine in different potencies. Majority of the medicines in our materia medica is proved in one strength, maybe in tincture, maybe in 1x, maybe in 2x, maybe in 3x, like that. So if you prove the medicine in different potencies, like say like 3x, 12x, 30, 200, 1000, or 2000, like that, you will get specific medicines. Specific medicine. So the according to the potency, the susceptibility, according to the nature of the miasm present in the medicine, it specifically act on the medicine. I'm telling you, I got a lot of medicines potency wise specificity. I'll tell you one example. You can verify, my viewers, my dear doctors who are hearing me or who are seeing me, can test this also, can verify this also. For example, if you take Bryonia tenum, and if you give it in osteoarthritis, it has got specific action on the knee joint in osteoarthritis. You don't take any symptom. No, you do not consider any symptom. It will
And
specifically act on the knee joint. Why? This Bryonia tenum specifically act on the joints and ligaments of the or even the cartilages of of the knee. Similarly, I will give one more example. I got a hundred examples of this, but I will give another one. If you have uh, cervical spondylosis, you give specifically Naxomica tendon. It specifically act on the cervical muscles of the neck. And that symptoms will be got relieved within few hours or few days, 1 or 2 days. But I don't say it is a cure. I don't say it is cure. That requires other things. And as our science says, you have to seek on the anti-miasmatic drug, yeah, and the constitutional drug, like that. But these are all things. I don't know. I don't believe there is much difference between constitutional medicine and miasmatic drug and all. It depends on you. It depends on you. One doctor will say it is constitutional. The other doctor, I gave the miasmatic drug. One other, I followed the complementary medicine, like that. So they have got so many explanations according to their well and wish. No, so that is all there. Similarly, I'm about to complete. I will say only one example also. Similarly, have you ever thought of spongia? the miasmatic effect I am saying in medicine. Spongia we will give. You will never see such a medicine in allopathy or Ayurveda. Spongia you can give both in hyperfunction of the thyroid and you can give in hypofunction of the thyroid. No medicine in other systems of medicine like that. One medicine is used for hyper and hypofunction. That is the peculiarity of the miasm and peculiarity of the Homeo system. And next one, as an example, you have to verify. If you give symphytum 30 in fractures, it will help the bone formation, callus formation, and it will heal it. But suppose if you give symphytum in high potency, it will remove the bone. For example, you can give in what you call it as exostosis. You can give in exostosis. High potency is a symphytum. Suppose you got a bone tumor like thing, you give in high potency, it will remove it. So that is the presence of miasmatic effect in drugs. With these two examples, I am likely to stop my class on miasm. I hope you may differ also, but you can have your own. I said it is debatable always and not conclusive. You can tell your views. Thank you all. Thank you for patient hearing without any this one. So give me much feedback and thank you all for all of you gave me and thank you IFSH and thank you Dr. Finish. Thank you.
Yes, Dr. Hari Kumar, it's really an excellent session indeed. And you really thrilled us with your different kind of presentation. That's what I have observed. We have observed here because people used to define miasm in different way, but we know that Dr. Hahnemann was lived in a different situation, and he at that time there was no such thing called the scientific examination of all these things. They were no, he was not aware about these viruses, bacteria, all that. But he used to say that there are certain invisible things that lives in the organism that may be the reason for some of the diseases. And of course, that's very absolutely right in the latest scientific knowledge. Your mode of explanation of miasm in a different way, that is materialism, dynamism, and all these things and how it unite together to work for making a person ill, and how hypo and hyperactivity is different, and how it works in different situations also. Anyway, it is a time for discussion. Those who want to participate in discussion may please raise your hand so that we can allow you to unmute yourself and you can speak to Dr.
There is one question in chat box. Spongia, which potency for hypo and hyperthyroid?
Sir, I can't hear you. Sorry. Hello?
One question is there, sir. One question
Okay.
is there. Spongia,
Okay,
which
please.
potency for hypo and hyperthyroid? From the chat box.
Potency. The potency can decide or not only with this miasmatic level only, it requires certain other. But in general, you use high potencies in hyperthyroidism, and in hypothyroidism you use low potency usually. But I don't think the tinctures using in hyper or hypothyroidism is not homeopathic. It's not homeopathic, and you don't get a homeopathic action also. To be homeopathic and for homeopathic action, definitely it should be a potentized medicine. That's my view. And moreover, I want to stress one point that is not told in my talk. That is, I don't think allopathic medicines and other medicines will interfere with homeopathic provided you give a potentized medicine. That too, if it is higher potency, it will never interact. That is why you can very freely give diabetic patients, hypertensive patients, along with their medicines, you can give potentized drugs. It will never interfere. If at all it is interfering, it will interfere with Ayurvedic drugs only, usually. And in my clinical experience is if you are giving allopathy along with allopathic medicine, what I used to say is you keep 15 to 30 minutes after or before allopathic drugs you give homeo. And if you are giving Ayurvedic drug, you keep 1 hour. Because because if you are giving tincture, for example, you are giving for hypertension broad fear tincture, the other people are also using the same thing. Understood? So you should keep one hour apart, at least minimum 30 minutes. But for allopathic medicine, it requires only 30 or 15 minutes, provided you should give it in dynamized form. Your medicine should be in dynamized form. Okay. Thank you. Hello. 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 I can't hear. Hello.
Yes, sir. I think Dr. Danesh left from here. Something network issue.
Hello.
Hello, can you hear, sir?
Hello. 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 Hello.
Hello. Can you hear me, sir?
Yeah,
Yes,
now
sir.
I can hear. Now I can hear.
Okay, sir. In your experience, which is the which medicines, like specific medicines, which homeopathic medicines is most useful for diabetes, the
No,
potencies also.
that I can give you at the class. No, this is something connected with Miasm. No, why? So that we'll deal in another class. No, it's a doubt mainly should be concentrating on Miasm and philosophy and all. So therapeutic we'll discuss in another class. No.
Okay, okay. Sir,
Okay.
which miasm it is more
All
in
the
your
three, I told you, no, any morbid state, all the three miasms, depending on the recessiveness or dominancy of the miasm, the symptoms in diabetes also more. You can get a diabetes with the syphilitic miasm in predominance, and all the two miasms will be there. For example, if you are getting a diabetic nephropathy or diabetic neuropathy or diabetic ophthalmopathy, there the predominance will be the syphilitic miasms. That's why you get a ulcer, a gangrene, ending in amputation and all, and you will get loss of sight or retinal bleeding or detachment of the retina, ending in blindness, or you will get a heart attack without pain usually, causing bleeding into the cardiac vessels in diabetes mellitus. So that is a predominance of the syphilitic miasm. Then if the psoriatic miasm only which is predominant, then you will get only the general symptoms like increased appetite, increased thirst, increased micturition, like that. No. So in any morbid state, all the three miasm, depending upon the Great. No. That means recessiveness and the dominancy, the symptoms also changes. Understood?
Okay, sir. Thank you.
Thank you for asking question. Thank you.
Yes. Yes, thank you, Dr. Hari Kumar, and those who attend the session in this evening. Tomorrow we will have another session at the same time. Hope all of you
Thank you,
will
thank
join.
you. Thank you. Congratulations, Dr. Hari Kumar.
Yeah,
ji.
sir.
Very
Sir,
nice. Very nice.
I
Wonderful presentation.
I was expecting you all the time, but you didn't.
Role of miasmatic and miasm
Ram,
are a medicine. Miasm are a medicine. you select the remedy and angle of treatment. Other angle of treatment, subjective angle, miasmatic angle, and pathological angle. The miasmatic angle is the very right angle, and chronic disease, select remedy, and cure the disease. Very well, thanks.
Thank you very much, Ram Paresh sir. Sir, thank you very much.
Okay, with
I
that,
was always seeing you with a very good smile face always.
it's really a dynamic person.
Yeah, you are very dynamic, always with a smiling dynamicity.
Happy New Year,
Full of,
Dr.
Thank you very
Dhanesh.
much, sir. Thank you very much.
full of positiveness. Full of positiveness. Okay. With
Positive
that,
energy.
we come to
By
the end
seeing
of
you,
the day.
I get positive energy.
Yes. Positive
Thank
energy,
you all.
always
Thank-
positive energy. Positive energy is the best energy. हम हैं
Right,
अमर
sir.
निरोग है सर्व शक्तिमान है सुंदर जुआ बलवान है धनवान है भगवान है पॉजिटिव एनर्जी शुभ भावना
Okay, sir. Okay, sir. Thank you. Thank you, Dr. Thank you, Dr. Hari Kumar, and those who attend the session. With that, we come to the end of the day, 1952.
52.
Over to Dr. Good night.